Hi, how are you? This is Dr. Farley. I want to be going over with you today some key concepts to overall health and understanding why we're seeing massive amounts of people not getting better, and how the current model of a drug for everything and genetic lies basically for all diseases they just don't work. And we're seeing more and more people get sick, and more people have their lives way below where they should be based on these concepts. So one of the biggest things that we started to learn early on was that there's this thing called stress. It was originally studied by Hans Selye, medical doctor. I think it was in the 20s and 30s. And he was also put forward for a Nobel Prize, and was a smart guy. He started to look at the patients and say, you know what, all of these patients that have all of these different disease names, they all look generally not well. So he started to look at the general look, and after a while he called it stress. And after they did the study of this, what they realized is that the stress was a brain hormone reaction. So it's the hypothalamus pituitary adrenal axis. And that there's a certain amount of that loop, we'll call it, that's supposed to be released. And you have the brain hormone release, and you respond to the stress, and then it resets itself back down. So let's just look at a rubber band per se, and knowing that the tensile strength on a rubber band is supposed to be about a 2. So that gives us 80% to stretch out and manage stressors. Okay? The other thing we have to talk about also is stress is not only mental emotional stress. And when we classify it that way, we are missing the biggest stressor creating most disease, which is chemical stress from, guess what? Food. So we have the 3 types of stress: mental, emotional, physical, and then chemical. And the biggest chemical stressor is from the food. Now, why is that? Because the food comes in and you may create an antibody against that food, or you can create a local immune response and release chemicals, and then gradually those chemicals go up and they say stress, 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 stress. So what we need to realize is that, back to that rubber band analogy again, it's supposed to be 2 of 10. And if it gets stretched out because we're stressing the system on a regular basis, we get a new set point. That set point that experts refer to is called the allostatic load. So this is really the emphasis and my expertise. I'm a fellow from the American Institute of Stress. I've studied this for a long time frame. And realistically, everything that my office does is to assess your allostatic stress load and then identify how to lower it, so that over time your body, the power that made the body, can heal the body at a much higher level. And we don't even realize what we're doing that creates massive problems inside of us. So what actually takes place inside of us when we have those stressors coming in, and then you fire off the stress response, which again is the brain hormone reaction? We have a bunch of things that happen, and we've known this. It's called your fight or flight response. And again, it's supposed to be short term. Up, oh, and then respond. You run, you fight, or you run and you're out of there. And it's supposed to turn off again. You're supposed to go back to that number 2, tensile strength. Most of the people that I'm seeing are coming in, if the tensile strength is supposed to be 10, I'm seeing people coming in at 12. They're totally blown out. And the system is just being run into the ground. And then we get things called diseases of adaptation, or diseases of civilization, as a lot of the newer stress researchers like to talk about. And what that means basically is we've taken our tensile strength from 2, where it's supposed to be, a normal stress level. And now, because we stress it too much with the different stressors, physical, chemical, mental, emotional, we may reset it now, and now we're at a 5, a 6, a 7. That means we have a lot less adaptability to manage stressors when they come in because we already have the pedal to the metal per se. So again, think about an idle in the car. If the idle in the car is supposed to be at 1,000 RPMs, and at 7,000 RPMs, 8,000 RPMs, the engine's going to burn out. It's like having your car idling at 6,000 RPMs. There's not much left there before you're in total burnout. And then once you're in total burnout, the intelligence that made the body, that can heal the body, we call this innate intelligence, it's not making a mistake. It's trying to manage the current stressors that you're putting on yourself, and then it does whatever it can do to adapt or manage the higher stressors that you're putting on it. And then what we do is we come along, as the drug docs like to, and we're going to try to push these down. So 3 very simple, extremely common diseases that we see: high cholesterol, high blood pressure, and diabetes are all diseases of adaptation. Look at just those 3 things. Look at the healthcare costs to the United States and the world, and look at the amount of people that die from this because their allostatic stress load is above normal. And then if I happen to come along and measure your blood, and as part of the normal response to the stressors, I need to raise cholesterol, the intelligence of the system, because cholesterol is the precursor to all my stress hormones, or I die, the body's going to raise cholesterol. And now I come along and I say, oh, Mr. Jones, you have high cholesterol. So let's give you the drug for the high cholesterol. And maybe we drop the cholesterol down from 257 to 195. We think we've done something good. But remember, we have not addressed the underlying stressors. And now, every single drug that we take raises our allostatic stress load higher. So, now you may lower your cholesterol, but you die sooner. You may lower your blood pressure, which again is another normal response to the stress reaction. And you may lower your blood sugar with 3 different medications. And at the same time, you will die earlier because you have not addressed the original stress, and now you have more stress in the system. Now, how do I know this is happening? Because look at the top causes of death in the U.S. They're all over there. Not only are they the top causes of death in the U.S., but now look what happens. When the coronavirus moves through, these are the weakest systems going. Their allostatic stress levels are through the roof, and now, boom, they just drop dead all over the place. They die at 10 to 12 times the rate. It's not the seniors that are dying at 10 to 12 times the rate. It's the people with those risk factors, those diseases that are being treated with these medications that are at the most risk in society. So, a few other things just to go over with you. What you want to know about the stress reaction. And I'm probably going to have there'll be some type of a little pamphlet attached to this. Dr. James Chestnut really broke this down very well, so I'm kind of summarizing some of the information from his stress response breakdown. But you get increased cortisol, increased catecholamines, your heart rate goes up, you get increased vasoconstriction, blood pressure goes up. Blood pressure goes up, your blood sugar goes up, your blood lipid levels go up, so that's your cholesterol and all your triglycerides. You have increased clotting factors, which means you can have a risk of a stroke. You have increased protein degradation in muscle and connective tissue breakdown. So we start looking very frail. Our muscles basically get damaged. And connective tissue damage can turn into joints and skin and saggy skin, looking very old. You get insulin resistance, which can create metabolic problems, weight issues, and again, diabetes. You also get feelings of stress, fear, anxiety, depression, I'd even throw in there bipolar, schizophrenia. All of these things that we're calling psychiatric or psychological are really neuropsychiatric imbalances, and many of them are being triggered by the stress response. The National Institutes of Health, the National Institutes of Mental Health, has now published a paper called the RDoc that all the research on any of these named diseases like anxiety and depression and bipolar, you can no longer study the name anxiety. You must study the underlying neurophysiological imbalance. And it's all going back to, guess what? The stress response. Can you imagine that? PTSD. All of our soldiers, this is what's happening to them. So you also get decreased short-term memory, ability to concentrate and learn new material. Sure sounds like dementia and Alzheimer's to me. Learning disabilities to me. You get decreased serotonin and increased noradrenaline. Serotonin has a lot to do with the gastrointestinal system, and it's the feel-good neurotransmitter, also involved with motivation. You get increased sensitivity for sensory systems, including those for pain. So chronic pain patients are likely stuck in a chronic stress reaction. Never mind looking at the shoulder and the neck and the knee and the back and calling it an orthopedic problem. Let's think bigger. You also have decreased cellular immunity. Your risk of cancer is through the roof. Your risk of catching bugs, germs, diseases through the roof. Your risk of dying of coronavirus through the roof, or the next virus that comes through. You also have decreased anabolic hormones like growth hormones and testosterone and luteinizing hormones. These are short kids, by the way. These are people that are in constant breakdown, a catabolic breakdown versus an anabolic buildup. And they also have testosterone issues. So testosterone issues in men are going to show up as andropause and erectile dysfunction and depression and all kinds of issues and premature aging. And all the other hormonal imbalances in women show up as cycle issues and menopausal issues and that whole picture. And then lastly, we have bone loss and muscle fiber type changes. So osteoporosis, osteopenia. And remember also, inside your bone marrow is where all your stem cells are that turn into red blood cells, white blood cells, and platelets. You also have muscle fiber type changes. Your muscles, they just deteriorate over time. I remember when I was dissecting humans, and we would cut these muscles open, and they would splinter apart like an old piece of potato sack because the muscle fiber was so damaged from the high stress response. So what we need to realize is this. Any of these diseases of adaptation that you may get or your family members may get, this is what's killing everyone in society. And these are not pathological. These are a normal, natural response to the stressors coming in. So everything that we do basically is we measure the Super 7 Plus testing. We measure your allostatic load. We run blood work to look at your allostatic load. We run specialty blood work to look at your allostatic load. We run immune panels to look at your allostatic load. And then we're absolute experts in identifying which gears are off and then what is the most appropriate treatment to lowering your allostatic load. And when we take the rubber band that's stretched out from, again, 0 to 10, and it's out on 12, and now we may be able to bring it down to a 4, magical things can happen. And then, and only then, the power that made the body can heal the body. Hopefully you found this interesting. If you have any questions, as always, please let the office know. Thank you and have a great day.